Hi, everyone, and thank you for joining us for National NSSLHA's office hours, clinical fellowships, and externships. Put your best foot forward. National NSSLHA Office Hours is a live event series designed to bring students and professionals together to talk about topics that are relevant and important to current students. My name is Rebecca Willer, and I serve as National NSSLHA's Vice President of Programming in Speech Language Pathology. I'm a current speech language pathology graduate student at the University of Wisconsin in Madison. I'd like to introduce our moderator for tonight, my executive council partner, Sal.
Thanks, Rebecca. My name is Sal Paporto, and I serve as National NSSLHA's Vice President of Programming for Audiology. I'm a current AUD student at Montclair University. I'll be monitoring any questions you might ask throughout the night.
Before we get started, we would like to take a few minutes to thank our sponsor, the Speech Pathology Group, for their support of this event. I'd like to invite Ms. Jennifer Lopez and Ms. Anna Davis from Speech Pathology Group to share a few words.
Thanks, Rebecca. I'm Jennifer Lopez, and I know Anna and I are both very excited to be here. We love working with NSSLHA, and we have been a sponsor for several of their events. We may have seen some of you at Orlando previously and shared some cookies and some laughs, so that was a great event. Just to tell you a little bit about the Speech Pathology Group, we are a multidisciplinary provider of services across care clinics. From the name, you can guess, we started with just speech pathologists many years ago, before my time. And we are now providing a variety of services. We have OT and PT, we have behavior intervention services, as well as school psychologists. And we're really working across settings. So we've got early intervention settings, school-based positions, clinic. We're also providing in-home services to our clients. So there's a lot of things that SPG does, and Anna's going to talk a little bit about kind of what we provide, but some exciting things about us are our ability to really reach our community. We have a branch of our company called Children's Services International, as well as SPG Gives Back. So we do a lot with our community, and we do a lot with our university outreach. Like I mentioned, we love being a NSSLHA sponsor, but we also partner with many organizations at the university level so that we can make sure that we are providing, whether it's continuing education or specific guest lectures and things, to make sure that we are giving back to our students. So we're very excited to just be here and answer questions. Anna and I both also work on our recruitment team. So we do a lot of interviews and a lot of placements for our new graduates. So I'll let Anna talk a little bit about kind of what we provide.
Hello, everyone. Like Jennifer said, thank you for having us. You know, SPG, we really pride ourselves on offering top-notch mentoring program, not only for those RPE and CF candidates, but also for each clinician that we hire. All of our employees are assigned a clinical supervisor, someone they can call at any time, for resource support, site visits, problem solving, and so forth. Our CF supervisors are hand selected. We put them through a series of trainings and offer them ongoing support so that they're able to effectively mentor and support their CFs. We also make sure that our supervisors have time built into their schedule to supervise. So none of our supervisors carry a full-time caseload. So they have all the time in the world to offer that CF what they need their first year out. SPG also offers professional growth opportunities. We have special interest groups related to culturally and linguistically diverse populations, AAC and AT, as well as interdisciplinary ABA. And we've got more coming. We're starting some DHH SIGs, and we also have Jen and I run a new hire cohort for anyone who's new to us, new to the schools. We're there to support you as well. We also are a professional development provider and put on monthly trainings free to our employees, which is a nice perk. These are offered through a webinar platform. We also have trainings that are specific to the setting our therapists work. And so, for example, our therapists that are placed in a school setting, we have trainings that are specifically designed around California Ed Code, what to do in the schools your first year out. So we really want to make sure that our therapists are prepared, whatever setting that they're working in. And all of our employees have access to an employee portal that's loaded with tons of therapy and assessment resources, tips, handouts, and other templates. And last but not least, with SBG, there's potential for advancement within the company. Whether you want to take on supervision at some point, I don't think it's ever too early to think about what the future holds or where you see yourself in 2 years or 5 years or 10 years. We want to make your dreams come true. And, if you do have a passion to supervise, that's absolutely an opportunity with SBG. Or if you have a desire to develop a presentation or an in-service, we really want to support our therapists and their future goals. So that is SBG in a nutshell. We're excited to be here.
I would just add that we are having a raffle tonight, so you will be seeing some information in the chat box that you can access. We are actually raffling off a Hydrate Spark water bottle, so very high tech, and so look for that to enter that raffle.
Thank you, Ms. Lopez and Ms. Davis. In just a moment, you will see a poll pop up on your screen. If you'd like to receive more information from the speech pathology group and automatically be entered in their contest to win a Hydrate Spark water bottle, please answer yes. Otherwise, please answer no. At National NSSLHA, we understand that applying and interviewing for clinical fellowships and externships is a rewarding, yet long and sometimes difficult process. Between crafting resumes and cover letters and preparing for interviews, applicants can find themselves feeling overwhelmed. The current state of the world due to COVID-19 makes the task increasingly difficult for current applicants. Because of this, National NSSLHA wanted to offer a way for students in the clinical fellowship and externship application process to seek advice from professionals and other students who have firsthand experience. Tonight's office hours is a two-part event where we will first hear from early career professionals who have recent experience with applying to clinical fellowships and externships. Then we will hear from CSD-related professionals with experience on the hiring side of the application process. We're fortunate to have a panel of professionals who took time out of their busy schedules to help us all prepare for the clinical fellowship and externship application process.
Although we have developed questions for the panelists, this event is meant to be an open discussion. Please use the Q&A feature to ask questions during tonight's event. You'll also be able to see questions that other people have asked and upvote your favorite questions. We'll try to prioritize the questions that have the most upvotes, so please check to see if someone else has asked a similar question before you add a new one to the queue. You can also feel free to add comments via the chat feature.
And with that, I would like to introduce our early career professionals, Erica Baldwin, JJ Wicker, and Marlene Puente. If you could please introduce yourselves and include your discipline and place of employment.
Yeah, so hi everyone. My name is Erica. I'm an SLP clinical fellow for Sidekick Therapy Partners here in Knoxville, Tennessee. So we're a private practice that also does early intervention and contracts to schools. So right now I work with pre-K through 8th grade in an elementary and middle school. I also went to Ohio State for undergrad and did grad school at UW-Milwaukee.
And then I'm JJ Wicker. I'm a pediatric audiologist at Primary Children's Hospital in Salt Lake City, Utah. Got my bachelor's degree in communicative disorders and deaf education. Obviously, my doctor of audiology at Utah State University. My PhD is in disability.
Hi, everyone. My name is Marlene Puente, and I'm a bilingual speech-language pathologist. I'm currently finishing my clinical fellowship at Neurorestorative. It's an inpatient post-acute brain injury rehab. We mostly work with adults 18 and over, and just mostly brain injuries and spinal cord injury.
Thank you all for being here. So now we can get started. So I think a good question to start off with is, what is one interview tip that you'd wish you would have known when you were applying for clinical fellowships or externships? Marlene, if you want to start with this one.
Yes, sure. One tip that I wish I would have known is to ask about the work environment. I think I was really focused in trying to do really well and ask the right questions. I kind of didn't ask like what a caseload would look like, if we would have like PRN, people covering for us, how was the work environment between the speech pathologists, if we also got continuing education, things like that that finally mattered to me while I was working. How much supervision I would get from my supervisor, you know, where they would set aside hours for us or not. So things like that, I wish I would have asked during the interview process.
Thank you. Erica or JJ, do you have anything to add?
Yeah, I just wanted to add, you know, the confidence factor when you're in an interview process, being proud of who you are. And, you know, a lot of times the thought processes going through your head are that you want to be impressive to them, but really you're the powerful one. You've got all the education, you have passed all the tests. So be proud of that, and don't be afraid to portray that. I think it's okay to have the mindset of they're wanting you to accept them. I think that's important.
Yeah, I would also say I wish I'd thought to ask about things like documentation a little bit more. I think in graduate school, we really focus a lot on like therapy, which is so important, right? Therapy and assessments and treating. But I didn't really think about like who does the schedule and how often do I have to write notes for my patients and what does that kind of look like? So I think knowing that would have been good, just to kind of get a better idea of what my daily workload is going to be like as a CF. And it can vary from place to place. So I think that's also good information to get from a potential employer.
Thank you. And I see a lot of people in our Q&A are wondering what's the best way to find a well-rounded work environment to make sure you end up in the field that is right for you. JJ, if you want to start with this one.
So best way to find a well-rounded work environment to make sure you end up in the field that is right for you. I mean, so I think that working while you're in school, working with the coordinator who helps you with the placements, making sure that you get experience in the areas that you think you're going to be best at, so that you have that foot in the door for when you are ready to find a job in that particular practice area. I think that's going to be the most important thing if you're going to be in the area that's right for you.
I would also add, I think it's important to talk to current clinical fellows or audiologists or people that are working for the company or school you're interested in, just to hear firsthand from them what their experience has been like. I think is really important to kind of see what the work environment is like, because the employer can tell you anything, right? But if you really hear from the people that are working there that it really is a great place to work and they really enjoy it and they're very supportive, then you know that you're going to find a better fit for you, I think.
Really good advice. Yeah, Marlene, do you have anything to add?
No.
Perfect. Sal, do we have any other questions from the audience?
Yes. So I'm seeing someone asked, is it hard to find a medical placement for a CF in speech language pathology?
Great question. Marlene, do you want to take this one? Because I know you are working in a medical.
I think right now it's not. I know that it may seem like it is. Well, at least in the Houston area, there's a lot more medical SLP jobs being opened. But I think initially it's a little bit hard because when we had panelists come to our university to give us like speeches, they did talk about having a little bit of experience, and that means trying to get an externship in the medical field. And sometimes that's not always attainable, you know, that's not always the case. And so always just continue to apply, and then always make sure that you are doing some continuing education courses if you didn't get the experience, volunteer, kind of putting yourself out there and building those connections and just getting that experience in any way that you can.
Really good advice. Another question that seems to be getting a lot of upvotes is, what can make students stand out when applying for a medical CFY if it's hard to get hours in the medical field right now with COVID? Or maybe just more generally, what's a good way for CFYs to stand out when they're applying?
Well, in my case, I know I did a lot of research when I was in graduate school. So I know when I was doing my interview process, they asked, even though it wasn't really related. So they were kind of, interested that I was doing research, that I was also volunteering on the side, even though I was just in grad school. Like, at that point, not a lot of people are volunteering. So I was doing that. And then I was also working and had a job. And then I was also going to school. So I had a lot of things kind of going on, and I was still able to, do well. And so I think they were kind of interested that, I was able to work well, I guess, under pressure, right? Sometimes it's a little bit more of a fast-paced job. And so maybe that was one of the things that maybe stood out to them. I'm not sure, maybe that's a question for the other panelists to answer, since, they kind of are on the other side, but I'm assuming maybe that's a good way to stand out.
Yeah, definitely. Erica, do you have anything to add?
Yeah, it's funny. I actually just had my annual meeting with my regional lead today, and we were talking a little bit about like the application process and this panel. And she said that the first thing that she looks for on a resume, she said, I might be different. I don't know if other hirees are like this, but people that hire. But she said that she just scans right down to work experience, because she thinks it's really important that applicants have even if you worked at McDonald's, or not there's anything wrong with that, anywhere you work, really, just having job experience, having experience working a job, I think teaches you things like time management and organization skills that are really critical to the job that we're about to do. But it's really hard to kind of learn how to do therapy and learn all those things at the same time, right? So having work experience can be something that's really important to an employer and can help you stand out, I think, in my experience.
Really good advice. JJ, do you have anything to add?
No, I think what they said is perfect.
Great. And just so that everyone knows, we will be saving some of the questions if we think that they apply more to the professional side of things. So if you don't see your question answered, we might be getting it till later on in the presentation. Sal, do we have another question from the audience?
Yes, we do. So someone in the audience asks, how far out from graduation should we begin applying for CFs or fourth year externship placement, or for CFs or fourth year externship placements?
Really good question. JJ, would you like to take that one first?
I'm so embarrassed. My dogs were fighting and I did not hear what the question was. Can you repeat it for me?
That's okay. So the question was, how far out from graduation should a student begin to apply for a CF or a fourth year externship placement?
So I know that for audiology, you usually will apply the October of your third year for your fourth year to start that following summer. And I know it can fluctuate depending on where you're applying to. I just know when I was getting ready, I knew I wanted to be in a hospital with peds. And those applications were usually between August and October is when they were opened, and they were due by that time, around that same time frame.
Good question. Marlene or Erica, do you have anything to add?
Yeah, I would say it really is never too early, honestly, in my opinion, in my experience. I wanted to work somewhere and move somewhere that I had absolutely no connections. And so I really started putting my resume out there, just the summer before I would even start working, just putting feelers out there, trying to make connections, because the worst you can do is apply or reach out to an employer and they say, hey, we're not hiring right now, but we'll save your resume for when we are next or a few months from now. So I think just any way to make those connections can never hurt. It's really whenever you're comfortable, but I don't think there's such thing as too early, honestly.
Good advice. Marlene, do you have anything to add about the medical field specifically?
I was a little different. I applied kind of late, just because I wanted to focus on my comps part of the, when I was still in school, and do focus on the praxis. So I applied around February or March, and I graduated in May. and they were really flexible, and they waited for me almost, I got the job like in April, so they waited for me almost 3 months. I started in July, and they were even more flexible. They're like, hey, do you want to start in August? If you want to take the whole summer off, like, we're okay with it. And so I didn't want to wait too long because I wanted to start working. But I think, like, you know, how Erica said, it's never too early. I just wanted to wait, and, you know, obviously it took some time, but yeah.
Thank you. Sal, what's our next question?
So another audience member asks, how did you complete job application processes? Did you go through Indeed or ASHA or state conventions, etc.?
Good question. Erica, do you want to start with this one?
Yeah, sure. So I actually applied and found my job through the ASHA Career Portal. That's how I got mine. But I know that, you know, Indeed's great. There's also, if you're interested in the schools, some states have like school career portals. Like I think in Wisconsin, it's called We Can. I'm not too familiar with other states, but yeah, looking into seeing if there's like an education network in your state, if you're interested in school jobs, I think is another great way to go. I'm not sure if Marlene knows more about where to apply for SLP medical jobs.
I don't have necessarily like a website. I know that and I do not endorse them, but the Med SLP Collective, they have sometimes job postings and stuff like that, and they also help you. I found my job because I finished it in my externship, but I also, because I was considering moving cities, what I did was I found the hospitals and rehab centers that were there, and then I applied directly to them. So I didn't go through like Indeed or anything like that, just because sometimes those jobs don't appear in Indeed. And so I didn't want to miss out. I just kind of Googled what hospitals, what rehab hospitals there were, and that's kind of how I did it.
Thank you. JJ, do you have anything to add on the audiology side of things?
So I do feel like a lot of times you pick your fourth year based off of where you want to work, and usually the fourth year position will, or a lot of times, I shouldn't say usually, but a lot of times the fourth year position is geared so that you roll into a full-time employee at that same facility. And then for me, I was looking for both clinical and or academic positions. So if you're looking for like a clinical assistant professorship somewhere, there's the communicative disorders. I always forget the acronym, but there's an acronym for looking up positions specifically at a university. I don't know if anyone knows that off the top of their head, but I've forgotten what that acronym is.
Not super familiar with it. Maybe we can put it in the chat later.
CAPSID?
Oh, what was it, Alexis?
CAPCSD. It's CAPSID.
Thank you. Thank you very much. Sal, what's our next question from the audience?
So another audience member is asking for advice on moving from the state that you graduate or are attending school to pursue a CFY or a fourth year externship in another state.
Ooh, good question. Erica, I'm going to throw this one to you again because I know you moved for your CFY.
Yes, I moved from Wisconsin to Tennessee. I think the biggest hurdle is the licensure process, really, especially due to COVID this year. It was a little bit more backed up. I had a whole kerfuffle with my background check, completing it out of state. Like, the best advice I can really give you is to find the phone number or email of the licensure person of the state and keep calling them, and don't take no for an answer. Just keep calling until they really answer and get back to you. Ask if they can't help you, see if they can give you the phone number or an email of someone that can. I've seen a lot of people posting in like SLP, CF Facebook groups asking other people, hey, are you in California? Are you in Tennessee? Like, have you heard anything? And I think that's a great way to do it too, honestly, because like I've just recently connected with a girl moving from Mississippi to Tennessee, and I just like gave her the phone number and email of the people that helped me really sort through the licensure process. So if anyone is moving to Tennessee, reach out to me, I got you. But I would really encourage you to try and find connections in just even on Facebook like that, of the state where you're moving, to try and figure out how to jump through those hurdles a little bit quicker by finding the right people.
Thanks, Erica. Marlene or JJ, do you have anything to add?
Yeah, so, and we're talking going into a CF or into an actual clinical job, right? I keep thinking that we're talking about going into a fourth year for some reason, because I'm an audiologist, so that's how my head is working. So since I have that clarification, one thing that I would ask for is see if there's a way, if your institution that you're going for will help pay for some of your move, because a lot of institutions have that available where they'll give you a stipend for X amount of money to help you rent a truck or whatever you need. A lot of institutions have that sort of infrastructure, so I'd be sure to ask for that and don't be shy.
And JJ, you can definitely answer from an audiologist perspective, because we do have audiology students on the phone call as well, or on this webinar.
Sweet.
Marlene, sorry, did you have anything else to add? No? Okay, sounds good. Sal, what's our next question from the audience?
Sorry, I was just getting the questions back open. I lost them for a second there. So another question I am seeing is, what is some advice that you could give to an audience member about if they possibly weren't able to get the placements that they had necessarily wanted because of COVID and things being less in person?
Really good question.
Let me rephrase that. How they would possibly stand out to an employer, even though they had not gotten the experience in the field that they had wanted.
Makes sense. Marlene, would you like to start off with this one?
Yeah, sure. I would probably do some continuing education courses. Show them that you're trying, right? That you're putting yourself out there. That's something I would probably do. And if you didn't get a position, let's say you wanted to be in the medical field, right? I would say you get a CF in pediatrics. So it's okay, you got a CF in pediatrics, but continue to keep up with your education. And if a job opens up, then you can already show them, I was doing my pediatric placement, but, I was still keeping up and so on and so forth. So I would continue still to keep up with your education. That is one way that shows them that, one, that you're really valuable, you really are trying. And I think they would really appreciate that.
Thank you. Erica or JJ, do you have anything else to add?
Yeah, I would say in general, when you're like interviewing or going for a placement and you might not have experience with a specific population, I think it's important to remember that as a CF from the SLP side, at least they don't expect you to have experience with everything. I know it's a little bit different when you're like going for a medical placement and you haven't had a medical position, but I think just really talking about how important it is to be like adaptable and flexible. Like, I'm going to rely on evidence-based practice. I'm going to work really hard, I think if you have a really strong passion for it and you convey that in the interview, I do think that that's meaningful to an employer. So yeah, in general, if you're in an interview and they ask you like, what's your experience with this population, it's okay to say you don't know, as long as you say that you're adaptable and flexible, you're going to work hard and figure it out.
Thanks so much, Erica. And JJ, this is the last question before I move to the professionals, but do you have anything else to add?
No, other than, I really 100% agree with what both Marlene and Erica said. What you don't want to do is you don't want to let COVID be an excuse. And I know that that's really hard to say out loud because I have no clue. I can definitely try to empathize with you, but I didn't live that experience of trying to find a job during COVID. But I would definitely not try to make it look like an excuse of like, oh, I couldn't do this because of COVID, because everyone's going to have barriers throughout their professional career. You want to show them how you work through those barriers. So that's why I echo Erica and Marlene.
Thank you again to our early career professionals for sharing your experiences and answering our questions. Now we're going to switch gears a little bit and hear from our professionals who can answer questions from the hiring perspective. So now I would like to bring in Alexis Redman, Anna Davis, Joanne Ward-Williams, Jennifer Lopez, and Dr. Mayrose McInerney. So if you could please introduce yourselves, starting with Alexis.
Sure. My name is Alexis Redmond. I'm ASHA's Director of Career Management Resources. I support the development of content for the ASHA Career Portal. And I also study the trends in terms of job postings and all kind of factoids about what's happening in the recruitment space for ASHA and ASHA's members.
Thank you, Anna.
My name is Anna Davis, and I'm a speech language pathologist. I work for the Speech Pathology Group. I am one of their directors of school-based services. So basically what that means is I support all of our speech therapists and our SLPAs that are placed in the school setting throughout districts in California. I also work with Jen Lopez on a recruitment team. So we do weekly interviews with new candidates, those eager and excited to join the field, which I really love. I have experience working in all settings, and I'm actually surprised I ended up in the schools. And I love working in the schools, and I love supporting new and excited therapists out there.
Thank you. Joanne?
Hi, everyone. I am Doanne Ward-Williams. I am a bilingual speech language pathologist, and I am the owner of a private practice, TheraPlay Bilingual Solutions, with a focus on early intervention. And I have hired and employed clinical fellows in the past and loved it. And I'm also on the ASHA Board of Directors as the Vice President for Government Affairs and Public Policy.
Thank you for being here. Jennifer?
Hi, I'm Jennifer Lopez, and as Anna mentioned, I'm one of the directors of school-based services for the Speech Pathology Group. I've been in SLP for over 20 years, so I was clearly, 5 when I started. But I also work on the recruitment side. I'm also our lead SLP when it comes to our university outreach, and I support therapists as well as supervisors that are working in the schools.
Thank you. And last but not least, Dr. Mary-Rose McInerney.
Hi, I'm Mary-Rose McInerney. I was a director of audiology, a large audiology department at Hackensack University Medical Center in New Jersey for 28 years. So I did a lot of recruiting of CFYs and of AUD residents. Now I'm an associate professor at Montclair State University, and I am the owner of a private practice at Hackensack University Medical Center.
Thank you very much. So I see we have so many questions from the audience still left unanswered. So Sal, what's a top question from our audience?
So a really popular question that we are seeing since the beginning of the event is, what would a reasonable salary be to expect when you are starting either in a 4th year or in a CFY?
All right, so I'll kick off. It depends. So ASHA does do some rolling surveys on a biannual basis, and they try to do some for SLPs in schools, healthcare, audiologists in schools and healthcare, because there's a lot of factors that go into what determines a salary for a specific setting. It could be the market price that can be acceptable, the compensation philosophy of that organization, as well as, what's the cost of living in that area. So it's really important that you kind of consider all those factors when you're looking for positions in different areas. I'm going to add a link to the chat that has that whole article. It's going to walk you through that process, because it's going to be important to kind of know all those factors, because that's going to contribute to your ability to even negotiate if you want to go for a little bit more.
Thank you. Does anyone else have anything to add?
I would just add that as a private practice owner, another thing that really matters as well is the skills that you're bringing. So that is why it's so important that you all are very confident in negotiating your salary. For instance, if you're bilingual and fluent in another language, that is a skill that you would definitely want to bring to the table and talk to whoever you're interviewing with, because your salary will look different compared to some of the other candidates, because they're in certain areas, there's a greater need for that.
Very good advice. Does any other professional have anything else to add?
I'd also like to add that I think it's important to look at the complete compensation package. So I think sometimes new therapists get excited and focused on that salary number, but really you want to look at You know, are they covering your health and dental benefits? Is there additional money provided for your professional dues or ongoing education? So you really want to factor in all of that for your whole compensation. So I would encourage you not to get totally hung up on that initial number you see, because it can really vary between companies and school districts and different agencies, what that whole compensation package really looks like.
Really good.
And I would just like to add, from an audiology standpoint, many fourth years are receiving stipends, or they may not even be receiving a stipend at all. There are some that will receive salaries, but I would say, I mean, I don't know, Alexis, if you have the numbers, but I know that in the metropolitan New York area, it's only probably about, I'd say maybe tops a fourth of the fourth year residents in this area that actually you're going to actually receive a salary.
Thank you. Does anyone else have anything else to add? Okay, Sal.
Okay, I do. I'm sorry. One more thing I wanted to add. One other thing, just like Anna was saying about the compensation package, another good question to ask is also if you will need to purchase your own assessments and therapy materials. That would be a very big purchase, and that would cost a lot of money that you wouldn't think of out of pocket. And I know that has been issues in the past for some fellow. They wasn't expecting that. And different, you know, whenever I was becoming a clinical fellow, I know that was life for me, especially because I had to buy bilingual. So in both languages. And so that's something that you would definitely want to think about.
Thank you. Sal, do you have another question from our audience?
Yes. So what are some examples of questions that would be asked in an interview for a clinical fellowship, a fourth year, or a job interview even?
Ooh, good question. Maybe I'll give this one to either Anna or Jennifer first.
Yeah, I'm happy to take that. I think that there's a lot of different types of questions that, especially at for example, SPG, that we tend to ask. We want to hear about your experiences and what it is you're looking for. Like Anna mentioned, we want to hear about your long-term goals. Personally, I also like to talk about things like how you might handle conflict with other professionals, or if you are presenting results and a family member does not agree, how do you handle those types of situations? Being that we are located in California, we are a very diverse state. So I also like to hear about your experience with bilingual assessments and culturally diverse populations. So those are just some of the things that are kind of popping into my head. Anna, I'll let you see, maybe Anna does her interviews differently than I do, so maybe she has some other things to add.
Well, this reminds me of Jen and I go to some universities and we present to graduate students that are just about to graduate. And ASHA has a really great article. I know if you do a little search, it's like interview questions for SLPs seeking a pediatric job. And there's a long list of questions. And it's been a while since I looked at that, but I know last time I did, I realized, oh, I asked most of those. But I would just suggest, and kind of thinking about how to prepare for an interview. I love that article, and just kind of run through some questions and practice talking through those. Absolutely, like Jen, I really want to know, what are they looking for? What's their dream job? Especially for the grad students that are currently in an internship, I like to hear about what's been their biggest challenge, and just kind of documentation is always a good question. It just gives me an idea of our starting off point. And I understand that within a CF experience, there is still a lot of learning to do and training, and that's fine, So I think we all run our interviews a little bit different, but if you can find that article, I can try and find the link. It's great.
Thank you. Does anyone else have anything else to add?
Yeah, no, I think that Jennifer and Anna went over a lot of them. A lot of employers are focusing on behavioral type interviews. So one thing to kind of consider when you're doing behavioral type interview questions is that you need to be able to kind of, in a nutshell, say, what was the situation? What task did you perform? What action, occurred? What was the result? And so as you're prepping your interviews, kind of think through the different things that you might be doing in that setting and kind of have those little kind of like nutshell, postcard versions of that answer, because that's what's going to really make you be nimble on your feet, particularly as different things come out.
I just want to add one other thing. We all in graduate school have so much experience with different tests and things. And I can't tell you, we do ask a lot of questions about, what tests are you familiar with? What tests have you given? And I can't tell you how many people cannot tell me that. And it's not that they don't know, it's just that you start to freeze, you're nervous. Write down notes. I interviewed someone today and I asked a question and she said, I think I need to refer to my notes. I said, that is fine. And I was honestly happy for her to do that. And then she was able to let me know about some of the different assessments that she had experience with. So, prepare, write down things. It's totally okay. We all do it. So definitely, because I hate the fact that then that makes you more nervous when you can't come up with all of those acronyms. And so definitely, just jot some things down prior to going into that interview.
I think that's a really good point. And to be prepared for both kinds. Typically, when we interview partly behavioral and then also partly technical. I also think it's really helpful to be prepared that you may not be interviewed just by one person. We actually do team interviews now, and I think that can be jolting if you're not ready for it.
Very good advice. Does anyone have anything else to add before we move on to our next question?
I would just say that, go ahead, Ann.
I was just going to say, Jen mentioned, having your own notes, and this kind of leads me to talk about you're also interviewing that company. So I would say come with your own questions, I love it when I interview someone and they are firing questions off at me. It makes me see that they want to get to know the company. They want to learn more. They're really trying to find the right placement for them because I'm interviewing them, but they're also interviewing, our company. So I think that's really important too.
Great advice.
I think that,
oh, sorry.
No, I just think that that's really a good point because we actually really watch and see, can the student come up with a good question? I also, if I don't have on my employer hat and I have on my professor hat, I tell our students that, this is all about, is this going to be a good fit for you? It's not just that they're hiring, like you want to be hired. You really want to know, is this going to be a good fit for you? And that's how I really like to take the interview process.
Thank you. Joanne, did you have anything else to add?
Just really quickly, I would say that if you are interviewing for a position that is a bilingual position, you should be prepared to possibly speak in that other language. I know that when I interview for my bilingual positions, I do speak in Spanish to ensure that that language, that fluency is there, because the expectation is not just treatment with the little itty bitties, as I like to call them, but also it's important for me to be able to have that family interaction. That's a very important part of early intervention.
Thank you. Sal, do we have any other questions from our audience?
Yes. So besides coursework, is there anything else that would make a candidate stand out to an employer or to a supervisor resume-wise?
Good question. Dr. McInerney, would you like to start with this one?
Sure. I think that if you're looking at, one of our sites is a very strong pediatric site. So we do look for that experience. We also we are looking for bilingualism. So, things like that, I think definitely help a candidate stand out. With audiology, we often ask about their capstone and can they talk about their capstone? Are they interested in their capstone? And do they plan on continuing with it? So those are I think that those certainly would help somebody stand out.
Thank you. Does anyone have anything to add?
From what we kind of see in terms of Sorry, Jennifer. I was saying, what we typically see some of the trends on the job board is that being really clear to tease out those specific traits that are important for just that job position, because your real estate in your resume is really valuable. And I think oftentimes when you're coming out of school, you might have come from like the CV format where you think, I've got pages. You don't really have pages. There's a lot of research out there that says that employers probably spend less than 30 seconds reviewing most resumes. They go in a Z formation down the page. And so if you hide all the good stuff or you bog it down with too many words, you might be missing that opportunity to really stand out. So what we kind of recommend in some of the articles in the career portal is that take that job posting and see what order they've listed the responsibilities or functions and match that pattern in your resume, because you want to make it so that they can just go check, check, check. Yep, they're the perfect fit. So just be really thoughtful about how you're setting yourself up and communicating your strengths, because that can also help, even if someone might have more experience, if they've hidden it or put too many things to cover it up, people might not see all that benefit about them.
Yeah, I would second that. I think that was what I was going to add too. I think there was a question in the chat about should you just have a resume geared specifically for that job? For example, if you're going for a medical placement or a clinic. And I would say absolutely. I do, Anna and I do many interviews every week, and I do probably have 30 seconds to a minute to look at that resume. And so I am quickly looking at the different experiences because they have probably put in an application for a specific job or role. And so I am looking at that. And I also then take that and I kind of develop some of my questions based on those experiences. So it's really important to highlight those things for that interviewer.
I just want to add, personally, I like a clean one page to the point resume. So maybe Alexis can chime in and see what the ideal is. I know lately I've been getting resumes that are 3 pages long. And to be honest, I kind of like look at it and I just like move on, because all of that good information is now lost in 3 pages. And like, I can't look over it in a minute and pull out what I really need. So Alexis, I guess I'm posing a question at you. What would be the ideal resume length and how to just get to the point?
Oh, well, my favorite answer, it depends. So for those that are in, communication science disorders, because there's so many internships and externships that happen during your education, it's really important to think about when you're applying for different positions, curating those experiences. So just because you have all of them doesn't mean it's the appropriate experience for that application. And so we try to tell people stay under 2 pages. But really, if you're starting out, you might not need to talk about things that you did maybe in high school or maybe in undergrad. You might just need to focus on those last few years. So be really thoughtful based on what that posting is asking for. And sometimes do a little research on who you might be interviewed by, because then you might know, like, okay, let me include this last detail because I know that they care about this thing. Or, maybe their organization donates to a certain charity that you used to volunteer for. Those are details that it's that 3D chess move of being able to say, hey, I've thought about you. You're going to think about me because I'm adding in the special details, not just everything. So, once you get down to that important stuff, it's probably going to be like a page and a half, but include white space. Understand again, recruiters are reading a lot of these. So if they're having to go, inch by inch, they're going to give up after a while. So just think about that as you're developing your collateral.
These are all such great tips. Does anyone have anything else to add? No? Okay, Sal, what's our next audience question?
So someone from the audience is wondering if there are any helpful platforms to look for openings for CFYs or fourth-year externships or jobs, like LinkedIn, Indeed, websites like those.
Good question. I'm going to throw this to Alexis first.
Well, ASHA has the career portal, so we have our own job board that has specifically postings for, CSDs, externships, more senior level positions. But also the thing is that, there is a hidden job market. Let's be really transparent that, maybe 50%, if not more, postings don't actually end up posted on boards. So you want to have kind of a dual track strategy. Yes, have your favorite boards, set up those job alerts so they can get emailed to your inbox and you're not having to search every day. But also if you have some favorite places or settings, go and look at their direct websites, or start networking with people that work there, because there might be opportunities that will never make it online, and this usually happens often in healthcare settings. that it never makes it, onto a job board. Someone knows someone and they refer someone. So, think about that in both ways, because that's where you're going to find the best things.
Thank you. Anyone else? No? Okay, Sal, what's our next audience question?
So someone in the audience is asking for any tips about possibly navigating salary discussion when interviewing.
Good question. Yeah, so negotiating that salary. Let's see. Joanne, would you like to start with this one?
Sure. Well, as I said earlier, just make sure that you're confident in the skills that you have. You do not be afraid to highlight those skills that other candidates may not have, because that will help you in negotiating your salary. I think it's important, as mentioned before, to look at your geographic region, look at the setting that you're applying for, and also look at that whole comprehensive benefits package whenever you're negotiating your salary, because one person over here may have a lower salary, but may have more benefits, medical insurance, and having all of these CEUs paid and their licensure paid, where this salary over here may be more, but they're not getting any of these other benefits. So just make sure that you do your research and you know and you're prepared whenever you go into the interview to negotiate. It's okay to highlight yourself. It's important.
Thank you. Does anyone else have anything to add?
I would just add that, if you're working for a school district or you're thinking about going with a school district, their salary scales are posted. So there is no question about that. You're going to know exactly what you're going to make. So doing some of that research first to know kind of what some of those competitive districts are around you, if you are going with an agency or a private practice. Keep in mind that a school calendar is only 185 days and other positions are year round. So there's a big difference there. And then all they can say is no. A lot of companies have been struggling. Private practices have been cutting hours because of COVID, changing to teletherapy, and they've lost clients. And we've experienced that as a company as well. And so all they can say is no at the time. And then don't be afraid to ask, what could you do to put yourself in a position that you might be eligible for an increase or a negotiation? I really have great conversations with our applicants as well as our current employees when they want to talk about taking on more responsibility or what they need to do in order to be considered for that increase or for that raise. So, don't be afraid to ask it. It's an important skill to be an advocate for ourselves, and nobody's going to do it for us, right? Especially in a field where there are so many of us women in this field that we have to, I am guilty of it as well. I kind of just accept it. Earlier in my career, I just accepted what people offered me, and I had to really learn the skill of advocating for myself. So, don't be afraid to do that. And because, like I said, if you are valuable to them, they will come back and be willing to negotiate.
Thank you. Does anyone else have anything to add? Okay, I think we might have time for one more question, Sal.
So I'm seeing one question about materials that could possibly be brought to an interview, such as previous IEPs that were written, goals, reports, or in the case of audiology, research that was completed or graduate assistant work. And would these possibly make someone stand out more in an interview process?
Good question. Dr. McInerney, would you like to start with that one?
So if I understand, you're asking if you actually bring materials with you about your externship. Could you just clarify that, Sal?
Yes. So basically, it's the audience member is asking if it is beneficial to bring as much information about your previous experiences with you if you were able to bring them in the form of materials.
I have not experienced that. Having an audiology student bring materials with them. I haven't experienced it, so I'm not sure if I am a good person to answer it.
No worries. Has anyone experienced this and would like to add some information?
I'll take a stab at it. When we were doing in-person interviews, I did appreciate when people came in with a bit of a portfolio to give us copies of, obviously with any identifying information removed so that we could get a sample of their writing style and things like that. Obviously, right now with most interviews being remote, we are asking for some of that information. And so then there's usually a follow-up. So yeah, I mean, I think it's great. I interviewed somebody in the office prior to COVID, and she came in with this beautiful portfolio, and it was just so impressive. I think we talked about it in our office for like 2 days after that, and it really made this person stand out. So, I definitely appreciate just being so prepared, and we do like to see that because we like to see your writing style, what you've had experience with, especially if you are looking at a school-based position where there is so much documentation. I mean, there is in all settings, but specific documentation for those school-based positions.
Thank you. Anyone else have anything to add?
I would say really quickly that.
Go ahead.
Sorry. I was going to say that I appreciate whenever someone can come in and really talk through their experiences. I like to talk about successes that they've had within their clinical practicums and any challenges they had and how they worked through them and problem solve, because those are skills that they will need within within their CF and moving forward. So being able to problem solve through would be and through their experiences would be something that's important to hear.
Dr. McInerney?
I don't, I agree with that. And so just to go off of Jennifer, but to really agree with what you were saying is that, sometimes students will come in and they will basically talk about their experiences and then be able to relate their experiences to us at the clinic as audiologists, or what research we've done and that really, I think says, a lot, because it really does say that they have been prepared and they've looked at your website and they've learned about you, they've learned about the facility. And so it's really nice when they can actually, maybe they're not going to bring in a portfolio for us, but at least they can bring in their experience and say, like I worked in this program and I understand that you also have this program here, or something like that. And it just really makes a very nice conversation, which, I like to have when I'm interviewing.
Thank you so much. And thank you again, everyone, for sharing. This has truly been a wonderful discussion. If you have any further questions that didn't get answered, hold on a second. Our panelists have generously offered to share their contact information with you, and we'll be posting that at the very end of this event. Right now, we're about to pop a quick survey into the chat box. We'd love it if you could give us some feedback so that we can continue to improve our virtual event experience. We also want to encourage you to attend our National NSSLHA Speed Networking event on February 24th, as well as our next Raw Conversations event on March 25th. Our Raw Conversations will be a book club discussion. If you're interested in attending, we recommend that you start reading the book as soon as possible. In addition, we want to make sure you know that right now our NSSLHA Honors Program is open. You can nominate yourself, a friend, your National NSSLHA chapter, or even a chapter advisor for an award. Any CSD student can nominate someone for one of these awards, but in order to receive one of our National NSSLHA Honors Awards for students, you must be a member of National NSSLHA. If you're not already a National NSSLHA member, you can find out more about membership at nssla.org/membership. And if you're already a member, I'd recommend you check out our website anyways to make sure you're taking advantage of all your awesome benefits. Last but not least, tonight panelists have generously agreed to share their contact information with you in case you have further questions. Please keep in mind that they have extremely busy schedules, so they might not be able to respond to your questions right away. Please allow them multiple weeks to respond. And on behalf of National NSSLHA, we'd like to thank our early career professionals and hiring professional panelists for offering their time and expertise. We'd also like to thank our sponsor, the Speech Pathology Group, for their support of this event. This has been a wonderful discussion. It's only with the help of our dedicated members that the CSD community continues to thrive. This conversation has been recorded and will be posted on National NSSLHA's blog and social media accounts. Thank you and have a wonderful night.